Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.
From the St. Louis Public Radio Newsroom, this is The Gateway. It's Monday, January 25th. I'm Wayne Pratt. Some Black Americans are fearful of the coronavirus vaccine. Black doctors in the St. Louis region are leading the effort to calm those fears.
So it's really, really important that we get everyone on board, not just Black physicians, Black leaders, but also we need our pastors, we need our Black lawyers, our Black business owners.
In just a few minutes, St. Louis Public Radio's Andrea Henderson speaks with Black doctors about their efforts to address vaccine hesitancy in the African American community. St. Louis County Executive Sam Page says the first mass vaccination site will be somewhere in North St. Louis County. As St. Louis Public Radio's Corinne Ruff reports, that's because the area has the fewest number of people signing up to get the coronavirus vaccine.
Page named Damon Broadus to lead a vaccine outreach effort as Director of Health Promotion. Broadus previously served as the Regional Community Impact Director at the American Heart Association. Page says pre-registrations are aligning with racial and socioeconomic disparities, meaning fewer people in predominantly Black neighborhoods are signing up to get the vaccine.
We must engage communities that are underrepresented to ensure that everyone has access to the vaccine, and that's our commitment.
But Page provided few details about exactly what that plan will look like beyond partnering with community organizations. Page says the county older resident program will help older people without internet or email access sign up by phone. I'm Corinne Ruff, St. Louis Public Radio.
An analysis from the Centers for Disease Control and Prevention shows Missouri ranks last in the country for the rate of people who have received their initial dose of the coronavirus vaccine. The CDC says less than 4% of Missouri residents have received the first shot. That's as of yesterday. Illinois ranks 45th. Missouri and Illinois are slightly higher than the national average for people who have received both shots of the vaccine. The head of the St. Louis Health Department says it's only a matter of time before new strains of coronavirus are detected in the region. CDC officials say one variant recently found in the United Kingdom could become dominant in the U.S. by spring. St. Louis Acting Health Director Dr. Fred Eccles says that mutation is more contagious than the original strain.
So one thing that we've learned about the new variants is that they aren't necessarily more deadly, if you will, but they do spread more efficiently. So the focus has to continue to be prevention.
Eccles says evidence shows the new coronavirus vaccines can work to keep people from getting sick from that new variant. A St. Louis Democrat has been expelled from the Missouri House Democratic Caucus. The Missouri Independent says State Representative Wiley Price Jr. was removed after a censure earlier this month. Price is accused of having sex with an intern. He's also accused of trying to cover it up. Price and the intern have denied a sexual relationship. Price also denies the cover-up allegations. The U.S. Department of Agriculture has finalized rules for growing hemp, and Midwest farmers interested in the alternative crop can start planning. But as St. Louis Public Radio's Jonathan Ahl reports, it will still be a while before the hemp market develops.
Several states, including Missouri and Illinois, started allowing hemp production last year, largely to fill the need for the growing CBD market in medicinal supplements. But there was much more supply than demand last year. Prices dropped and hemp farmers didn't fare well. Dale Ludwig is with the Missouri-based Midwest Hemp Association. He says that rough first year wasn't all bad.
That a lot of people that weren't very serious about it aren't going to stay in the industry, and that gets the legitimate producers a better opportunity to profit.
Ludwig says the minor changes made to the USDA rule before it was published last week are good for growers, but he also says it will take at least 5 years before the market needs are stabilized. In Rolla, I'm Jonathan Ahl, St. Louis Public Radio.
Some African Americans in the St. Louis region are worried that the coronavirus vaccine is not safe for Black people, given historic racism in the healthcare system. Black doctors fear that kind of distrust will keep some from getting the vaccine and further harm a community that has been disproportionately affected by the virus. As St. Louis Public Radio's Andrea Henderson reports, Black doctors are using social media, attending virtual community events, and trying to convince Black people that the vaccine is necessary.
Dr. Matifasta Heshwayo Davis received the Pfizer coronavirus vaccine last month at John Cochrane Veterans Hospital. She was nervous when she received the first dose, but confident she did the right thing because she knows it will save lives. She hopes to be an example to Black people who are skeptical about the vaccine.
They have understandable and completely reasonable mistrust around what's happened in the past. I'm not going to win that battle with everyone, and I've accepted that. And that uphill battle is because there is so much mistrust, and we do need to get that information out there.
Heshwayo Davis is an infectious disease specialist. She says Black people may not trust the vaccines because of the way the healthcare system has used Black people in the past. Many point to the way doctors abused Black men for decades doing the Tuskegee experiments by observing those with syphilis and not treating them. Black people are dying from the coronavirus at a disproportionate rate, but Florissant resident Rika Tyler says she can't trust the system that historically didn't protect Black people. Tyler doesn't plan to take the shot.
I'm not saying that it won't be safe for Black people because vaccines have helped, with past viruses. But from a historical aspect, it's just the distrust that Black people have with the healthcare system, and then just the unresolved issues of that is what needs to be discussed.
Black doctors in the region are trying to address those fears by discussing the vaccine with their Black patients and speaking to Black organizations. They worry that if not enough Black people take the vaccine, then their communities will continue to suffer more hospitalizations and deaths. Heshwayo Davis understands that mistrust. When she meets with her Black patients, she acknowledges the racism and apologizes for the way the medical industry has treated Black people. Doctors say Black patients are more wary of the vaccine than white patients. Dr. Kanika Turner is Associate Medical Director at Family Care Health Centers in South St. Louis. She says her Black patients don't even ask about the vaccine.
What I've noticed, my white patients that come and see me, they're the ones that's leading off the conversation. That's actually, for majority of them, that's the first topic that they want to discuss. Like, what do you think about this COVID vaccine? But with my Black patients that I see, it's often me sparking that conversation.
Turner is the only Black doctor in the Family Care Health Center system. She says she has a duty to inform Black patients about the vaccine since she is the only doctor who looks like many of them. The family medicine physician has been talking about the vaccine on podcasts, at virtual town halls, and Black church services. But she can't do it alone.
So it's really, really important that we get everyone on board, not just Black physicians, Black leaders, but also we need our pastors, we need our Black lawyers, our Black business owners, our, barbers and beauticians. We need them.
Dr. Ashley Denmark practices family medicine at Missouri Baptist Medical Center. She makes sure she connects with Black patients on a cultural level because many of them had never had a Black doctor before.
A lot of times, Black doctors are here to try to reestablish and actually reimagine this relationship we've been having with the healthcare system.
Denmark started the organization Project Diversify Medicine in 2015 to help restore the Black community's trust in the system. The online platform gives advice to people of color who are interested in medicine. But Denmark is using its Instagram account to help spread the word that the vaccine is safe. Nearly 50,000 followers can view videos and photos of Black healthcare workers receiving the vaccine. Some Black St. Louisans definitely plan to take the coronavirus vaccine. North St. Louis resident Annetta Booth says it's the Black community's only defense against the virus.
I know what happened in the past, but we see every day different people, they have taken it, and nothing has happened to them drastically. I can't see any reason why African American community would not take it.
Black doctors in the region hope they can convince enough African Americans to take it because they know that only widespread vaccinations will save lives. I'm Andrea Henderson, St. Louis Public Radio.
Our David Casares edited that report. Shula Newman is the executive editor of St. Louis Public Radio. Music by Ryan McNeely of Adult Fur. I'm Wayne Pratt. From the St. Louis Public Radio Newsroom, this has been The Gateway.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.